right, good evening. My name is Rich Pizzillo, and I am the Executive Director of the New England Hemophilia Association. It is so good to see many of you this evening, especially as we're gearing up for the big holiday next week. This is a special webinar tonight. This is in partnership with the World Hemophilia Federation, and you're in for a treat. So often in America, we are focused on access of what we think access is, and we have many insurance issues. But tonight, we're going to go on a journey and learn quite a bit more about what's happening in the rest of the world and in the developing world. This is also a preview of what's to come for Giving Tuesday. So Giving Tuesday is a special event where it's global, just like the World Federation, where nonprofits like the New England Hemophilia Association support another nonprofit. Some nonprofits support themselves. We have decided for the past 3 years to support another cause. So causes in the past have been the Hemophilia Federation of America's Disaster Relief Fund for Puerto Rico. The past 2 years, Save One Life. So we have really proudly decided to partner this year with the World Hemophilia Federation to support their efforts during COVID-19. Over the past 3 years, during this day, which is the first Tuesday of every December, so it's Tuesday, December 1st, over the past 3 years, you have helped us raise over $12,000 for the two charities that I just mentioned. Incredible work there, and thank you. And you'll be hearing a lot more on how you can help after this webinar and then leading up to Giving Tuesday, which will be after Thanksgiving, and it's not that far away. So I joked around with Jennifer. I'm not going to butcher her last name because my name often gets butchered. So I'm going to let her say it, and I promise that I will learn to say it there. So Jennifer, the spotlight's all yours.
Thanks, Rich, and no worries on that at all. I'll say it for you. It's La Liberté. There's not going to be a test on that later, so nobody worry about that. So let me just set things up here. And I just, while I'm doing that, want to thank you so much for inviting us and giving us the opportunity to talk a little bit more about our work and the state of care with the global bleeding disorders community. It's really a thrill for us to be here. And thanks to all of you for logging on and joining us today. It seems like, I mean, I don't want to give it away, but it seems like many of you do have an awareness about the WFH already. So that's great to see. And I hope that we can address some of the points that you mentioned just now. It's certainly our goal to do that. So we're really excited to get started. So everybody can see that screen okay? We're all good? Perfect. Okay. So, you know, we really are one global community. And one of the things that always strikes me about the bleeding disorders community, and one of the things that makes it a joy for me to come to work every day, is that incredible sense of solidarity that exists around the world. And you're all demonstrating that today just by being here. So it's really a pleasure for me to have the privilege of working with this community. I've been with the WFH for nearly 10 years. I actually worked for 8 years and then went away and then missed this community too much and came back. And so I've been back at the Federation for about a year and a half now. And I'm really excited because in this role now I have the opportunity to connect with so many of you, and that really brings a level of joy to my work that I really am appreciative for. So we're going to talk a little bit today about what it's like to live with a bleeding disorder around the world, tell you a little bit about the WFH as an organization and WFH USA as well. We'll talk a little bit about how we're coping with the pandemic, how communities around the world and patient organizations are coping with the pandemic, and how the support we receive from our partners really is making an impact. And then we're going to talk about what lies ahead and how we can work together moving forward. So I am actually going to hand things over to our president of WFH USA, Eric Stolte, and he's going to take you through the first part of this.
Well, it's good to be here with you all. Hold on just a second. I'm getting okay, that's good. Yeah, so I have a child with hemophilia, hence my involvement. Been involved with the World Fed for quite a number of years. So I'd just like to introduce you to the World Federation USA. The World Federation was founded in 1963. So those of you who answered that, congratulations. Founded by a Canadian, Frank Schnabel, and now his grandson is on the WFH USA Board of Directors. His daughter Gina is involved with us as well. So it's neat to see the family over generations continuing their commitment to see hemophilia care advanced around the world. In 1969, we were recognized by the World Health Organization. And for those of you who might be trivia fans, that's the same year as the Beatles' Abbey Road album. Go Beatles. We now have 148 national member organizations from beginning with just 15. And if you've ever been to one of our in-person meetings, when we meet as a full organization, there's flags around the room. It looks like a mini United Nations. It's just amazing to be in that room. We have 6 regional offices around the world, but our international headquarters is in Montreal. And because of that international piece, we knew Zoom before it was cool, and we're using it quite a while before the pandemic, and now that everybody's using it. So very quickly, the WFH mission and vision. The mission of the WFH is to improve and sustain care for people with inherited bleeding disorders around the world. And I love our vision. Our vision is treatment for all. That vision is that one day, all people with a bleeding disorder will have access to care no matter where they live. You see, and the WFH USA then is the sister organization of the WFH in the USA. It's 501c3 there. So when you donate to WFH USA, your gift is tax exempt in the US, but comes to the WFH to work around the world. WFH USA exists to develop resources in the United States to support the work of the WFH. And so we work to build awareness, deepen engagement in the US with our global vision of treatment at all. The reason we do that is we believe that together we can make a real difference in the lives of people right around the world. So, what is it like living with a bleeding disorder outside the US? We know that about 75% of people living with hemophilia around the world have not yet been diagnosed, and 50% of those will die before age 10. It's tragic. But here's another way of looking at this based on statistics that we've gathered from the WFH's World Bleeding Disorder Registry. In the US, the median age at diagnosis for a person with hemophilia is less than 1 month. In fact, my son was diagnosed at birth. In Southeast Asia, the median age at diagnosis is 55 months. So children are not diagnosed. They're not seeing a single dose of treatment until they're nearly 5 years old. Can you imagine, folks, what that would mean for the quality of life of that child? The potential for future disability, not to mention the fear and anxiety that those children and families are having to live with for all those years. It's amazing. It's not good. But not only is diagnosis lacking, but inequity in access to treatment naturally follows that. You see, the US accounts for 5% of the global population, yet they consume nearly 30% of the factor VIII available in the world. This illustrates the tremendous disparity a person with a bleeding disorder has to access based on where they live. It's this inequity that the World Federation of Hemophilia and the WFH USA exist to make right. And as important as such numbers are, they don't tell the story of how people can be helped and lives saved. So I'd like you to listen very carefully to Judy. She's a Kenyan mom. Tell her story about her son, Steve, whose older brother had died from a bleed. She shares how the WFH's humanitarian aid program was a lifesaver. Here she is.
When we went to hospital, we were advised by the doctor to our supplies, the boy was bleeding in the brain. That is when the journey started. A very, very tough journey, traumatizing journey. The bleeding could not stop. The institution told me that they are going to give this boy the factor. And they promised me one thing, this drug is very, very expensive. So I told them, go ahead. Where will you get the money from? I told them, I don't know. What I don't want, don't let my son die. When we went back, God worked in a very miraculous way, because there was a nurse who was in turn and asked me, Mama Steve, you are taking factor. I'm going to connect you with a certain doctor in Kenyatta National Hospital. His name is Dr. Kibet. I asked, how much is they going to sell for us? Nothing. What do you mean? Where are they getting? Is it fake? Because I couldn't believe it was free. I thank God for Kenya Hemophilia Association, World Federation of Hemophilia, because they have really helped us.
Isn't that a wonderful story?
Hospital, we were advised by the doctor to our supplies.
Okay. What a wonderful story, eh? You can hear the incredulity of Judy's response in her laughter, as well as her joy when she hears that the factor is free. You see, folks, it's your support that has given Judy and Steve their miracle. Well, Jennifer, back over to you.
Thanks, Eric, and sorry for that little video mishap. I also have to take responsibility for an error in I'm sharing the presentation, and I think I've shared the version that I didn't correct the slide on. So if in case you're keeping track for future trivia, we actually have 147 member organizations, not 148. So I apologize for that error, but I just wanted to make sure you had the right information before we carry on here. So thanks very much, Eric, for that. And I really want to thank everyone again for being here. It's my job as National Director of WFH USA to try and share a little bit with you about how we've been adapting to this new normal. It seems ridiculous, frankly, to qualify anything as normal these days, but of course we've all been contending with this as best we can and finding ways to cope. So I'm going to spend a few minutes talking to you about what that has been like for us, as well as for the global bleeding disorders community. So the first order of business when all of this struck was to make sure that our community around the world had the information that they needed to make sure patients were aware of the risks, to make sure that treaters had access to the information they needed about how to treat people with bleeding disorders who might be coming down with COVID as well. There was a lot of questions and uncertainty and fear and concern. And so really for us, the first priority was making sure that people had the information that they needed. A huge chunk of the work that we do to support countries around the world is focused on training, and we do a lot of that in person. In fact, we were gearing up for our biannual World Congress in Kuala Lumpur, which was to take place in June. And of course, we quickly had to pivot away from all of that, as many of our organizations have done, and switch all of that to a virtual universe. And it wasn't just about changing the way in which we were delivering training, but in many cases it was about shifting away from what we had planned to do to really meet the more immediate needs of our community. And we'll talk a little bit more about that later. The other thing I want to talk about, in those early days of the pandemic, a huge priority was maintaining our community's access to our humanitarian aid program. To answer the question from earlier in the poll, WFH's program is the largest distribution channel for clotting factor concentrates in the world. And last year we distributed 241 million IUs. So good job. If memory serves, everyone, or the majority of people did get that right. But it is a tremendous source of product for many communities in many countries around the world. And so as lockdowns were put into place around the world, it became much more difficult for us to get that product into the hands of those who needed it. A little later on, you'll get a chance to hear from Barun, who's a founding member of the Hemophilia Society in Nepal, and he'll tell you himself what that was like on the ground. So I'll let you hear that directly from him, but suffice it to say that it was a very important challenge at the outset. And I'm pleased to say that we are now in a situation where our regular distribution channels have largely been restored, and patients once again can count on us in the way that they have come to over the last several years to get that treatment to them. Of course, we wanted to understand exactly what was happening with our patient organizations, our member organizations around the world. And so we reached out to them and asked them quite early on how they were coping and what some of the challenges and concerns that they had were. And this is what they told us. Clearly, there was a great deal of concern around lack of services at HTCs and lack of trained medical personnel. In some cases, this was because these things were always and had always been hard to come by. In others, it was a case of these services and these healthcare professionals being diverted away to cope with the pandemic as well. Lack of treatment products you see coming up here again is a very important concern for many patient organizations around the world and many patients, as well as government cuts. So concern that there were going to be cuts coming, or that was looming, or that it would come in the future as governments and healthcare budgets were being taken over with coping with the pandemic more directly. What's been interesting over the last several months is that I've had a chance to talk with many organizations around the world and across the US, and there's a remarkable degree of similarity in what everybody is coping with. And in some ways that's, I guess, comforting. But I think it's really important to remember that what the state of hemophilia care looked like at the start of the pandemic or before it struck really is an indicator of where things are today. So if things were already pretty bleak to begin with, well, they're only bleaker now. And that's why the WFH's work and our healthcare development programs, which are all really anchored in the notion of building sustainability. And that's why those programs are so important. So yes, we've talked about humanitarian aid and how vital it is to save the lives of patients who wouldn't otherwise have access to any treatment. But the work of the WFH has always been centered in building sustainability. So while we are providing humanitarian aid, we're also providing training. We're also, accompanying that with other healthcare development programs that focus on making sure that this is not a one-time solution to a problem, but that patients and healthcare providers are empowered to take better care of their communities. So one of those healthcare development programs is the Cornerstone Initiative. And Cornerstone is really designed to serve the most underserved members of our community. These are places where there's little to no access to diagnosis or treatment. And in times like these, dealing with a situation like a global pandemic, we really can understand how important it is to have a foundation like that in place, for there to be a patient organization that we can support and help better serve the patients in that community, for there to be healthcare providers that we can provide training to and that we can assist in taking better care of their patients. In the absence of those things, there's really very little that we can do. So while we have, and we certainly must, turn our attention to dealing with the immediate needs resulting from the pandemic, we really also have to continue that important work building capacity, especially in countries that are just starting out, so that they can be resilient when things like this happen in the future. And what's been really cool and amazing to see is that despite everything that we're living through, there's incredible progress that's being made in these countries. So let's take the example of Mozambique. It's a country, of course, on the southeast coast of Africa, a country with very low socioeconomic indicators. And they're enrolled in the Cornerstone Initiative and have made incredible progress. In the last year alone, they ran a widespread awareness campaign in print, radio, and TV that led to the diagnosis of a number of new patients across 3 provinces. They held their first ever patient meeting and developed resources to support these individuals and these families as they learned to cope with the diagnosis. They even constituted a women's group, and I love this. This is a group of mostly mothers of these patients, newly diagnosed patients, coming together to really support each other, to learn from each other on how to best care for their children, to discuss the challenges that they faced in getting that diagnosis, coping with all of this psychosocial aspects of that diagnosis, and really learning from each other and supporting each other. They even created an NMO website, which is of course so important to keep people connected as we have to stay apart. So, you know, these are very basic and fundamental steps, but they're those really critical first steps that will lead to meaningful improvements in the lives of patients there. And these are the kinds of things that are made possible thanks to programs like the Cornerstone Initiative. You saw earlier in that those survey results that, again, concern about government cuts and access to treatment were really high on people's priority list. And so clearly the pandemic has heightened the needs across the world, a greater need for advocacy, either to ensure that access to care is maintained, or in some cases to really even take advantage of this moment in time to improve things. If you consider that home treatment is really not available in most of the world, I think it's clear to see that this is a time that most people can understand how vitally important it is and why it's so important. And so communities are taking advantage of this moment to say, now is the time that we can get our governments to pay attention and really understand how vital this is. And so we wanted to be able to support those efforts. And this is one of those examples where we sort of, you know, scrapped the training plan that we had for the year and said, you know what, this is really where our community needs our attention, and this is what we need to support. So we've been running a series of webinars on advocacy in COVID times and supporting our patient organizations as they try to move forward with their own goals. And of course, as you well understand, an important part in advocacy is having access to data. In the US, this is done through a robust network of HTCs and AFIN, but that kind of registry and that kind of data collection is really non-existent in most of the world. And our World Bleeding Disorders Registry, which Eric referenced earlier, really fills that gap. It provides sort of an out-of-the-box solution that allows HTCs and healthcare providers around the world to begin collecting this kind of clinical data. And the uptake has been tremendous. This is a program that launched just in January of 2018, and you already see vast numbers, nearly 7,000 patients already represented from 84 treatment centers in 39 countries. So the need is there and people are keen to begin this work. You have a quote there from Dr. Safar, who's from Pakistan. She participated just recently in a training that we conducted because we are still onboarding centers despite the pandemic. We are still providing training because they not only get access to the registry itself, but all of the support and the training to obtain ethics approval and to learn how to collect and record this data, that's provided as well. And so we're really hearing that this is vitally important and tremendously helpful, not only to support clinical management of patients, but also those really evidence-based advocacy efforts as well. And then, you know, of course, having standards in place is really important, or understanding what the standards of care are critical to advocacy as well. And the WFH's guidelines for the management of hemophilia are a really vital resource to our global community when it comes to setting standards and being able to go to governments and explain what adequate care really looks like. And, you know, again, these guidelines are available and established in places like the US, but around the world, this isn't the case. And so they rely on the guidance that we provide to develop their own national guidelines and to take to governments when the time comes to advocate. So should we keep going, or did you want to stop for questions now, Rich?
I say we can keep going.
Okay, perfect. So just to finish us off here, I want to spend some time talking about what lies ahead. And again, I mentioned it earlier, we've been talking a lot amongst ourselves and seeing a really high degree of collaboration with many organizations. And there's no question that we're coming together and that we're moving forward. And it's that solidarity, I think, that really makes the strength of this community. So let's talk a little bit about what's ahead. The first thing is really exciting, and it's actually right now in progress. Today was the first day of the first ever WFH Global Summit on Women and Girls with Inherited Bleeding Disorders. It has been a priority of the WFH for some time now to make sure that women's voices are heard and honored within our community. And this is the first time that we are hosting a global event. Of course, we had planned to do it in person, but nevertheless, we are carrying on virtually. And this has been today, as I said, was the first day, and it continues tomorrow as well. So a really wonderful opportunity to learn how organizations around the world are supporting women and girls and advocating on their behalf. And I think for us to really come together as a collective and figure out how we can do better and do more to make sure that we improve the level of access to care for women and girls. And again, one of the things that really came through in the summit today, which featured a number of testimonials, is that this is being experienced by women and girls around the world, in the US as well as across the globe. So again, a real sense of commonality there that I think we can all learn from. Speaking of opportunities for women and girls, I wanted to make sure that you were all aware of the Susan Skinner Memorial Fund Scholarship Program. This is an incredible program that gives young women the opportunity to attend our World Congress and General Assembly and really develop their leadership skills and empower them to become advocates for the future. And this is a program that has been running for some time, but we recently took a look at what we were doing and worked with the task force to try and find ways to make it a more meaningful and more empowering opportunity for our young scholars. So this is something that's going to be rolling out sort of in the first half of next year. And I wanted to mention it because I have no doubt that there are many incredible young women and future advocates and future leaders within the New England community. And so I encourage you to keep an eye out for that. Any girl or woman can apply for that scholarship, and it's a really great opportunity to build our future leaders. One of the things that we realized, again, from our survey and just in communication with all of our national member organizations around the world, is that there was a vast and immediate need resulting from the pandemic, and those needs were really diverse. And we wanted to do more to be able to address that. And so we created the COVID-19 Relief Fund. We talked about the pivot that we've all made and joked about how we're all Zoom experts. And I certainly don't consider myself a Zoom expert, but I can log on and manage this much. So that's something. But imagine what it's like if you don't have a computer at home or you don't have reliable access to the internet. Maybe you only have a phone, and maybe the only time you have a reliable connection is when you're at work, and maybe you're not at work anymore. So all of this incredible training and resources that are available online are only valuable if you can access them. And that's just not the case for a really large proportion of our patient organizations. And so we want to be able to equip them with the software and the connectivity to be able to access those trainings. I mean, to give you an example, we actually had a couple of patient advocates that wanted to participate in a training and couldn't access couldn't access it. And so we set them up in a hotel for a couple of nights just so that they could have a reliable connection and take advantage of that training. So these are the kinds of things that are happening, and we want to be able to empower our communities to take advantage of all of the great resources that are available. There's a number of costs that are rising associating with access to treatment because of lockdowns and other difficulties in accessing HTCs. And so we want to help our member organizations offset some of those costs as well and help patients get the care that they need, as well as just making sure they're safe, just simple things like making sure they have vital PPE. So these are the kinds of things that the COVID Relief Fund was designed to address. I'm really proud to say the WFH board has committed an initial investment of $100,000 to this fund, and we really want to do more to be able to support our community, our global community and our global family, and really, I think, show the strength and solidarity of the community. So that's what that fund is all about, and we're really excited to see what the community has in store, the response that we get, and to be able to help as many of our member organizations as patients as we possibly can. So I'm going to stop talking now. I'm very excited to be able to introduce you to our special guest. Barun is the Senior Vice President of the Nepal Hemophilia Society. He was a founding member of that organization, and he's going to talk to you about what it has been like in Nepal and share his story with you. Are you there, Barun?
Thank you, Jennifer. Yes.
Oh, there you are. Thanks for joining us.
Namaste from Kathmandu, Nepal.
My name is. Go ahead.
Yeah, my name is Barun Khakurel. I am a person with hemophilia A. I was also one of the founder members of Nepal Hemophilia Society, and currently I'm working as a senior vice president in Nepal Hemophilia Society. We established NHS in the year 1992. The same year, we became the member of the WFH. Back in 1990, the only treatment we had was to infuse whole blood. After that, we come to know that we could get fresh frozen plasma, FFP, at the Central Blood Bank in Kathmandu. Beside me, I had an elder brother who was a hemophilic patient in our family. We used to visit blood bank with our father to receive treatment, where we met other PWS and their parents. Then we decided to register NHS. At that time, we have only 13 members in our community. Tragically, I lost my brother because of brain hemorrhage. That's when I decided I should do something better for this community. We ran few awareness program in the hospital inside Kathmandu Valley. We also published brochures and pamphlets. We started publishing articles in the newspaper and through radio. Despite so many challenges, we now have our own office building. There are around 750 members across the country. We also have 7 chapters in 7 different provinces. With the help of the WFH, we successfully running a training program with Swedish Hemophilia Society since 1999. In 2008, the government of Nepal put hemophilia as one of the disabled category. In 2017, the government quoted in Disabled People Right Act that the necessary medicines for a person with hemophilia will be provided free of cost. Due to the continuous advocacy through all these years, now the government of Nepal have allocated budget to procure a factory in central and provincial levels. Province one government had already procured factors. The budget was around $100,000 US. Back to you, Jennifer.
Thanks, Barun, for giving us a sense and for being here, for sharing your story. I know people really appreciate it. Can you tell us what it was like in those first few days of the pandemic in Nepal?
In the initial days, there was a situation of terror and uncertainty in most people. Office started being closed and employees are working from their home. people started avoiding going out in public. And finally, on 22nd of March, the government announced the lockdown, which meant that there was a complete restriction on the movement. I was also worried about my own health and works. For the hemophilia community of Nepal, like any other sector, it was a difficult time. We do not have a home treatment of system. PWS received treatment either from the care unit at Bir Hospital, Civil Service Hospital, or the provincial hospitals as an on-demand care. Because of the limitation on the transportation, it was difficult for many to access treatment, as all the donated products were stored at the NHS head office. It was also a challenge to send a factor to the hospitals and to send factor to the provinces. We were worried that our member might lose their lives. Jennifer.
Yeah, I can only imagine. So what did the Nepal Hemophilia Society, sorry, what did you do to respond? Like, how did you try to help?
We were in contact with the members and doctors on a day-to-day basis, and all of us were looking to solve the issue. We informed the members not to go to the hospital unless they face severe problems through the social media of NHS. The factor stock was running low, and we were in communication with the World Federation of Hemophilia for the next factor donation. We had received a donation offer as well. It was unfortunate that the government of Nepal announced lockdown all of a sudden. So there was no way to receive shipment. At that time, we arranged plasma and cryoprecipitate from the blood banks, keeping aside the remaining stock of factors for severe bleeding cases only. We found out that the government was providing aid to bring in emergency supplies, including medicines from different countries. That's when we started looking for alternatives to bring the factor donation. We wrote an appeal letter to the Ministry of Health to save the lives of our members. We also mobilize media personnel so that our problems would be heard by the authorities. Jennifer?
Wow. So I guess that was a situation when the lockdown was announced. How did the WFH help?
We contacted the Humanitarian Aid Department of the World Federation of Hemophilia on the 1st of April. We are in regular communication through the lockdown period. We are also in contact with the Ministry of Health for advocating to provide factors for hemophilia. It was uncertain if we would be able to get the donation or not. So it was a hopeless time for us. We were hoping that we would not get any critical cases. Thankfully, we did not. I'm glad that we contacted the WFH at the right time. The WFH then arranged the hemophilia factors from the Hemophilia Federation of India. It was a long process, and there was a frequent communication with the WFH, HFI, and the logistic company. And finally, we received the shipment on May 20, 2020. It was a huge relief for all of us, and also one of my greatest moments of life.
I understand they rented a truck and kind of just went across the mountains to get that to you. Is that right?
Yeah, the donation come through the by road, so we are in regular contact with the president of HFI, all federation, and the logistic companies. There was some situation I can't forget, so when the truck come to the Nepal border, there was a curfew going on at Birgans at that time, and the truck was stopped there for 3 days. Thankfully, we have a refrigerator in that truck, and because the truck has the number plate of Indian number plate on it, so the truck did not get the permit to come to Kathmandu. So it was stopped in so many places, so many checkpoints, and we were in touch with the driver and the logistic company in Nepal, and with the ministries of health and government authorities. It's a very difficult situation at that time, Jennifer.
I can imagine. I'm so glad that it got to you in time. And I just want to say thank you for everything you do to support your community there. They're lucky to have you. And we're lucky to have you here as well. I know it's super early where you are, so thank you for joining. Thank you for joining us. I'm sure everybody listening has questions for you. And so I just want to wrap things up on my end, and then we'll give everybody a chance to do that. If I can figure out how to move the slide. Oh, no. Okay, there you go. So I want to thank you all. I want to thank our friends at NEHA, Rich and your team. You guys are amazing. We love working with you, and we're so grateful to you for giving us this opportunity to share our work with your members and give people the opportunity to learn more about the work that we're doing, and hopefully inspire them to want to support patients and communities around the world who really do need their help. So any amount that you can give is appreciated, and the link is there, and I know the NEHA team will be pushing that out as well. So thanks so much for your engagement and for your support as well. And just before I leave you, I want to share one more little story with you. It's a great story of a young boy from Malawi named Comfort. Malawi is another one of those countries that's involved in the Cornerstone Initiative. And I wanted to share it with you because I think one of the things that this pandemic has done is really highlight or create an impetus for us to want to reach out and connect with each other. And in doing that, we've heard so many stories, so many incredible stories of hope and inspiration. And I just love this one. Comfort, as I said, is a young boy in Malawi who did not receive a diagnosis for many years, and as a result, he and his family lived with a fair amount of pain and uncertainty. And recently, at a workshop that we held there, Comfort learned how to self-infuse for the first time with product that was donated by the WFH as well. And we connected with his mom recently again to hear how he's doing, and she said he's just thriving. And so we said, well, what is he doing now with his newfound freedom, now that he has this access to care and this ability to infuse on his own? And she said, well, he's making music, he's entertaining us all. He made his very own guitar, and he's making music for his family. So she sent us this great little video that they recorded of him playing, and I just want to share a little snippet with you as a bit of a send-off. So so there you go. I don't know if he's taking orders. If anybody's interested in the guitar, I can see, you can let me know, and we'll get in touch and see what we can do for the holidays. But I can't help but have a smile on my face every time I hear him. So I wanted to end things off with that as well. So thanks very much, everyone. And we'd be happy to take your questions.
Jennifer, if that doesn't put a smile on your face, I'm not sure what will on a cold, almost winter night here. Thank you to everyone who presented this evening. It puts a lot into perspective living in the US. And there are a couple of questions that were privately sent, if I could read them out loud, and then the appropriate person, could answer them. So the first question that came in is, I would be curious to know what self-infusion training looks like in Nepal and other nations. Are kids learning to do this to increase their independence?
Barun, do you want to take that?
Yes, sure. Self-infusion training was successfully conducted in all provinces on January 2020 this year. The purpose of the training was to train PWS and their family members because most of the people live in remote areas where the medical staffs were not easily available. More than 100 persons, including PWS and their family members, were trained during the program. the training becomes fruitful during the lockdown period when the movement was completely restricted, and it's been helpful when the patient received home treatment therapy. Thank you, Jennifer.
Great. Thank you very much. Another question that came in is, do countries like Nepal have access to newer treatments like Hemlibra or some of the longer acting treatments?
We were just been informed by the WFH that by next month, I think we're going to have a Hemlibra. We are receiving that product, and it's already in the process. Because of the limited product supply, we still have to rely on plasma and cryoprecipitate as well.
And is that administered in your home or in the hospital, cryoprecipitate? Because that needs to be iced or cooled, right? It can't be at room temperature.
Yeah, it was administered in the hospital only because we need to have a cold chain for that, and so it's not easily can be administered in the home, and the doctors should be there to see if there will be any problems during the transfusion.
And do kids have ports and PICC lines, or adults, or is that not common in places like Nepal?
Sorry, I didn't get that.
Do kids have ports placed in them or PICC lines, or is that not common, where they access the treatments to factor?
In Nepal?
Yes.
No. They receive treatment all ages.
Great. If there's other questions, feel free to put them in the chat, or you can just unmute yourself and ask as well. I have another question for you. Did hemophilia run in your family, or were you a mutation?
I think I have my mother's elder brother was died because of the continuous bleeding. That means we have a genetic bleeding disorder.
Great. Thank you. And then this question, I think this is more for Jennifer. What is the life expectancy for someone without access to treatment in developing countries?
Well, that's a good question. Actually, we recently, WFH recently did a study sort of looking at that, not so much life expectancy as I think it's called life expectancy disadvantage. And so I'm not gonna remember the actual percentage because there was different ones varying depending on the economic situation in the country. But I do know that in high income countries, the disadvantage was 27%, and in the lowest, I want to say it was like 70-something%. So I don't want to misquote, but I mean, I can share the link to the article if you like, but there's definitely a tremendous disparity. And what the study showed is that the lower the socioeconomic status of the country and the lower the access to treatment, the higher the discrepancy in what was called life expectancy disadvantage. So the expectation of a change in life expectancy because of hemophilia. I think I saw one of my colleagues on there who's from that team. So Tung, if you're on there and you want to jump in, feel free to. She'll know better than me, but I don't want to put you on the spot.
There is another question that came in here is, can you explain how it helps to leverage the humanitarian aid factor donations with the government to advocate them to start to purchase factor? Great question.
Yeah, it is a really great question, and it sort of speaks to this idea that, you know, while humanitarian aid is really important, it is also a part of the tool, a tool in the arsenal towards sustainability. So the idea loosely is that when humanitarian aid is available in a country, then you see typically an increase in the number of diagnoses because, quite frankly, people can be helped, and so they're more likely to be diagnosed. And then as you start to treat them, if you're able to collect that data, which is why integration with things like the World Bleeding Disorders Registry are so important, then you can start to show what happens to patients when they have access to care and the improvement in their quality of life, et cetera. And then you are able to use that as a tool for advocacy to go to governments and explain by showing them data from their own country that when patients have access to this treatment, they fare far better. And so then governments have an added impetus to want to get on board and purchase product. Also, I mean, you know, humanitarian aid is, you know, it's our goal to make it sustainable for as long as we possibly can, but it's not something that we can guarantee for all of time. And so, you know, it's really part of our work to work with the patient organization and the healthcare providers in country to advocate for a government commitment.
Great, thank you. Another question that came in, and I think this was answered a little bit, but I think are kids and adults mostly on Prophy or Ondemand in developing countries?
So it's really variable. It really kind of depends on the state of care and how many patients are diagnosed. So it's hard to say. I mean, certainly there's the vast majority of patients living with bleeding disorders around the world are undiagnosed, frankly, let alone receiving Ondemand or Prophy.
Great, thank you. You know, as I'm listening to this, I came home from the office today and I have my box of factor waiting that I need to unpackage. And it puts a lot into perspective that in the United States, we can order these things. There's hurdles to insurance. You pay your co-payment and we have it here. So I sitting back thinking about those that are not as fortunate as us to make a phone call and to have it magically delivered a day later, which I think is exactly why it's so important for us in the US to have presentations and partnerships with this. So I'm just going to share my screen, Jennifer, if that's okay. So I'm just going to.
Yeah.
Perfect. Yeah, I just want to take everyone. This is the NEHA website here. As Brandon put in the chat, and you'll be seeing a lot of emails about this. You go down to Giving Tuesday, and here on the page, which you'll start seeing, there was an email this week, you will start seeing an email 48 hours out, 24 hours out, on the day of, there'll probably be 3 emails going out here. And what this is showcasing is how you can help. I know there was a couple of questions there of thinking more globally. So $10 supports equipments to help create educational videos. $20 supports or $20 will help defray delivery cost of treatments. $40 will help to support high-speed internet access to educational webinars. $60 will help groups organize outreach programs, and $100 will help a patient living in a rural setting safely visit their doctor. These are rounded numbers that will help patients that are in need. 100% of donations that come in, NEHA will donate to the World Federation of Hemophilia. We do not keep anything. This is a true partnership where we want this day to be about organizations that are collaborators and are helping those that are outside of our own community. So you will see more about this in the coming days after Thanksgiving, but I just want to thank you. I just want to thank all of you for being on here tonight. For those that are watching the recording, thank you for watching it. And I just want to turn it back over to Jennifer or Eric or anyone who kind of like to, you know, wrap us up here.
Sorry, struggling to find that unmute button. I told you I wasn't a Zoom expert. I just want to say thank you again. I mean, it really is a pleasure for us to have an opportunity to connect with you and share a little bit more awareness just about the level of access to care and diagnosis around the world. So thanks so much for being here. Thanks for your interest, your intention, and your engagement, and your desire to want to help. It really means a lot to the incredible number of patients that we are able to help, and we really want to be able to reach them all. So with your support, we're able to do that more and more. And so just thanks.
I'll add my thanks too, Richard and gang. Like, I really appreciate it. I lived in New England for a while. My wife is from Vermont, so I have roots there. So I feel for you guys, but your generosity and support, to me, the most startling statistic that constantly stays in my mind, our VP Medical made this comment, that 75% people around the world have little or no access to care. Of those, 50% die before age 10. And that's just startling to me. And as Jennifer was saying, it's those kind of things, those inequities, that your generosity helps to right those wrongs. And we look forward to the day when we can have treatment for all. So thanks so much for all you do.
Thank you, Eric. And thank you again to all of you, and to the World Federation of Hemophilia, and to Barun for joining us at now 6:06 a.m. in the morning, and for waking up early with us. I have not done a Zoom call at 5 a.m., so I hope you can take a nap today. And you know, with that said, again, I just want to thank you. This webinar is timely, leading up to Thanksgiving. It's that time of year where you pause and you're looking at what you're grateful for and thankful for. And for those that are on here, you have a link to the bleeding disorder community, whether you're a caregiver or a patient, someone you love, someone that you care for. So I just ask that you think about not only that tonight, but how we could help in a bigger sense. So with that said, happy Thanksgiving. Thank you for being part of this community, and thank you to all of you for putting this presentation together.